lot of it has to do because we've not moved into the information technology age. A lot of it's misreading prescriptions, reading instructions, and so forth, and people just making mistakes. 100,000 people a year. The numbers we had, last night the numbers changed on the stimulus package, at least in the Senate side. We got a resolve between the House and the Senate. And so there was a bit more in the IT area. You can make a case as to whether or not that's a stimulant or not, and people are debating some of these questions, whether or not you put the stimulus package or some other place. But it was, I think, about $1 billion or $1.5 billion, I don't know what the House numbers were. And I think we reduced some of that last night, along with civil construction and other things, to bring that number down. But there's a strong desire, obviously. This has got to be a part of whether we do it in a stimulus package or whether or not we do it as part of the healthcare system. You just can't move without this. It's ludicrous to suggest how we're going to maintain the system without taking advantage of the technology and information technology to update all of this. And there are a lot of very talented people that can fill it. Those are jobs that could be created as well to put people back to work. But Chris, do you want to comment?
Yeah, sure. I mean, in the end, I mean, one of the central questions here has to be, why on earth does this system cost 18% of our gross domestic product and get results that are, by and large, worse off or equal to systems that are spending 10 or 11%? And one of those reasons is the fact that we have not invested in that healthcare IT. I mean, just think of somebody coming into an emergency room for treatment here in Danbury Hospital. How much time could be saved if that person walked in with an electronic medical record, and that all of the tests necessary done just to get a baseline for that person didn't have to be done because you could go into that record. Because people's memories are fallible, you can't just rely on them telling you they've had that test done. That, you know, in order to make sure that all the I's are dotted and T's are crossed, that practitioner doing that upfront assessment has to duplicate so much of the work. An additional number I'll throw at you is that a RAND study that might be a little bit aggressive that came out a few years ago suggested that 1/3 of all healthcare is unnecessary healthcare. That is either duplicative or just sort of trying to cover somebody's backside. And a lot of that is due to the fact that we don't have great records. So sometimes people get a little lost in the conversation about healthcare IT. It's not the sexiest part of the healthcare conversation, but in the end, if that can really drive down costs to the extent we think it can, that's part of the solution on how we get the cost down and then use those savings to spread it out to more people.
Hi, my name is Laurel Shader. I'm the chair of pediatrics at Fairhaven Community Health Center in New Haven. Hi. I just a brief comment about IT, and then more of a question about primary care. We are trying very hard to get an electronic medical record, and we recently got a quote that it was going to cost us $1 million for the setup and initial teaching for our staff, which is somewhere between 20 and 25% of our operating budget for the year. So tell me when we're going to get an electronic medical record, hopefully in my lifetime. My other comment, I think, more is about why people like myself are taking our IB educations and going into primary care as often as people used to. One of the joys of primary care, obviously, is the relationships that we build with our patients and their families. One of the frustrations that is becoming more and more of a frustration, and I think a real disincentive to people, is going to be the amount of my day that I have to spend on the phone, talking to the insurance company, finding out why the formulary has been changed, and the medication that my patient has been doing so well on for so long is no longer available to the patient, and I have to switch to something that may not be as effective. And I know why that is, because the insurance company got a better deal than what the another pharmaceutical company. And so it's a better deal for them, not for my patient. The amount of time that I have to spend every day just